Guys, good morning. Listen, before I have to run back to Washington in a few minutes again for the week, we had a very, very good discussion with our public health officials at the state level, at the local level, along with some of our private healthcare providers, Gunderson, Mayo representatives, talking about the steps that the state of Wisconsin and locally we're taking to get out ahead of the coronavirus. Now, this is not a time to panic. This is a time for preparation. Try to get information out to the general public about what we're dealing with right here, steps that are being taken at the federal, state, and local level, but what all of us as individuals can be doing more of in order to prevent the spread of the virus and contain it so it doesn't overwhelm our communities. With that in mind, last week, the U.S. Congress, in a very expedited but also bipartisan fashion, passed a funding supplemental bill worth $8.3 billion to address some of the urgent needs that we have in dealing with the coronavirus, such as the development of a vaccine, trying to move it to clinical trials as quickly as possible, and then establishing the worldwide distribution network that we're going to need once a vaccine is developed. That's not going to happen overnight. We have some of the best scientific and medical minds working on this, researchers trying to get to that vaccine, but realistically, we're looking at maybe a year out before something is available for widespread distribution with the general population. So in the meantime, a large part of the money that was appropriated in this bill goes back to the state and local public health departments for the resources, the training, the things that they need to do to prepare here at the local level on how best to address this virus. A lot of that money involves the testing kits that we're going to need. It's hard to know what you're dealing with until you get the data back, as far as where it exists and what we can do to try to concentrate it and prevent its spread. There's also a lot of money for the medical supplies, the resources, the respirator masks, other masks that our healthcare professionals need. They're going to be on the front lines of all this. We don't obviously want them getting sick, and then how can best be used and deployed in the general population. We also were able to get included in close to $500 million for telemedicine services. This could be very helpful when it comes to a contagious virus, that we're able to do a lot of this through telemedicine services and that, and try to prevent the movement of people around. Fortunately, here in Wisconsin, we haven't had a large outbreak yet, but I think it would be kind of silly for us to think that somehow our borders are immune to the spread of this virus. We're starting to see more of it on both coasts. It is spreading. Chances are it will continue. But I think we have to be led by the facts and the evidence as best as we know it, and just try to get that back to the general population so they know what's taking place. I'm going to leave it to our healthcare professionals, our scientific experts throughout the country and also at home to better describe what this virus is all about and the steps that we can be taken. But listen, CDC and the National Institutes of Health have put together very good guidance for us individuals to follow. Wash your hands. I mean, it just gets back to basic public health practices that we should be doing anyway, especially at the height of cold and flu season, which is also applicable to the coronavirus. Wash your hands, 20, 30 seconds. I think the example being used is, 2 happy birthdays when you're washing your hands, about that period of time in order to do a thorough job. Making sure we're covering up with our coughs and sneezes and not coughing into our hands that we might touch other surfaces that other people will come in contact with. If you're feeling sick, stay at home. Take yourself out of the general population so the virus doesn't have a chance to spread. Even if you're relatively healthy and don't feel strong symptoms, I think we need to be thinking about how we can isolate ourselves if we are feeling a little bit under the weather. Disinfecting surfaces that we come in contact with. Again, it gets back to sanitary standards again, trying to wipe down and disinfect and make sure we're doing a good job so that we're not spreading the virus. And then try to avoid touching the face, which is very hard to do, I mean, for a lot of us, myself included. But trying to get into that conscious mode right now of what we can do to protect ourselves, protect our families, and protect our neighbors. I'm very proud of the public health system that we have here in the state of Wisconsin. I think it's one of the best in the country, one of the best in the world. And it starts with the leadership that we have in our public health at the state and local level. I'm very proud of the healthcare providers that we have. We got the Mayos here. We got the Gundersons in our backyard. These are some of the best healthcare providers in the entire world. Got a very good rural healthcare system set up as well with rural healthcare providers. I'm visiting many of them over the last couple of weeks, making sure they have everything they need in order to prepare and to guard against that. And so with that, probably gonna have to slip out a little bit earlier, but I'd like to hand it off to Andrea Palmer, who's the Secretary of the State Health Department here in the state of Wisconsin, to give her perspective of what's being done at the state level, the recommendations that they're making, and then maybe we'll have a chance to listen to Jen Rumblowski too, who's the County Health Director here. And then we also have representatives of Gunderson at the far end and Mayo too. And if you haven't checked out their website yet, they just posted, I think within the last few days, a lot of good, helpful information about the coronavirus and steps that we can be doing individually and throughout the community in order to get out ahead of it. And I want to thank you all for the feedback you were able to provide me this morning. I'm having constant meetings with the federal task force, the interagency task force that's now been formed at the federal level trying to deal with this. So whatever they're telling me, I'm delivering to the federal task force. Any concerns, any issues that they're raising here at the state and local level, kind of acting as a conduit right now. So again, I'll end where I began. Time of preparation, not panic. We've got a lot of good, capable people thinking long and hard about this, how we can best contain it and limit its spread. But we're not out of the woods. And as soon as more testing kits become available, as soon as more of those data points are collected and brought to our attention, I would not at all be surprised if the numbers go up before they start going back down again. So that's the situation that we're in. And Andrea, why don't I turn it over to you then for your comments.
Thank you. Good morning, everyone. Thank you so much for bringing us all together today, Congressman. A really important discussion here at the local level. Last week, the Department of Health Services announced that testing for COVID-19 is now taking place both at the Wisconsin State Lab of Hygiene as well as through the Milwaukee Department of Health. In addition, CDC has expanded its guidance for testing so that a wider group of patients are now eligible for tests with a doctor's order, with doctor's permission. As a result, the number of people in Wisconsin who are being tested for COVID-19 is rising, and we think that is a critical thing to be doing, and we are anxious to continue to expand the number of folks who are being tested across the state of Wisconsin. It will really help us know as soon as possible who has the virus and where they are, so that we are able to move to mitigate and reduce the spread in whatever Wisconsin community that might surface in. So in the coming days, as we are testing more and more folks, we also anticipate more of our partners, both in private labs as well as other labs, to come on board with testing capacity. And so we will continue to ramp that up so that we are able in more real time to expand our testing and continue to increase the number of folks in the state of Wisconsin who are getting tested. I will say we are currently not, we don't have any sort of backlog for tests. We don't have a bandwidth problem, but again, as we are expanding the pool of folks who are being tested, we do want to make sure that we expand our capacity as well. That's an important part of this. So we have an experienced and really dedicated team at the Department of Health Services. I feel very lucky to work with all of them, as well as our partners in local health departments and our provider community, as witnessed here today. Because this situation is evolving, it's going to continue to evolve. And so the relationships and the work that we do with all of these partners and the strong communication that we have with them is critical to being able to, as this evolves, give the best guidance, work through the facts on the ground as they are happening, so that we together can really make the best decisions to protect the people of Wisconsin as this situation continues. So it's our mission to continue to be as transparent as possible, to share with the public and our partners the most up-to-date information as soon as we have it. We continue to do almost daily media briefings and would welcome participation, and have had great participation actually from the La Crosse press in those daily media briefings. And we also want to make sure that people have access to the information that's coming electronically. So we do update our website daily, every day at 2 p.m. And so that includes the latest we're getting from CDC. It includes the latest counts of testing that's going on here in Wisconsin so that you can have a reliable, quick source every day at 2 o'clock for the latest on the numbers here in Wisconsin. I want to go back to something that the congressman said. It's critical to remember that the kinds of really good hygiene practices that we ask you to practice for normal flu season are applicable for the coronavirus to help prevent the spread of illness. Wash your hands with soap frequently. And I would also encourage you to get a good bottle of lotion, because when you dry out your hands, you become less likely to wash them because they get a little sore and raw. So also have your favorite lotion on hand so that you are not inadvertently discouraging yourself from continuing to keep them clean by washing them with soap and water. Cover your coughs and sneezes, and stay home when you're sick. As businesses and childcare facilities and nursing homes and assisted living are starting their preparedness planning or continuing their preparedness planning, we encourage you to think about your employees, to think about your sick leave policies, to think about how telework or how classes at home, how you might continue your operations sort of no matter which sector you are in, and the kind of things you need to think through to be prepared and to be ready to continue to execute on your mission should you need to alter your daily operations. Again, there are good resources, good starting point resources available on our website to get you to be able to start thinking about that, and we are certainly available for technical assistance and questions as they arise. It is still the flu season, and the same resources that we're utilizing in our healthcare systems to deal with seasonal flu are the resources we are going to need to deal with COVID-19. So I would encourage you to get your flu shot if you have not done so already. That is an important thing you can do to protect yourself and protect your community, but also, again, reduce the draw on our healthcare resources, which we need to be focused on preparing for COVID-19, as well as for treating folks that they need to in their healthcare systems already. So I'm grateful for your time today, and I will close with that and appreciate any questions you all may have.
So thank you, Congressman Kine and Secretary Palm. I'm Jane Claycamp, I'm the Associate County Administrator. I'm just gonna take a minute to introduce the people up at the table, and then we'll say a few remarks, and then there will be questions. So I'll just help move that along. So to my right at the end is Jen Rombalski. She is the La Crosse County Health Director, and has been very active in studying all this. Obviously met Secretary Andrea Palm. Next is Dr. Abigail Dale, who's the medical supervisor at the UW La Crosse Student Health Center. And then Dr. Jeffrey Jensen, who's the chair of hospital practice for Mayo Health Clinic, or Clinic's Health System. And then to my immediate right is Bridget Path, who's the Administrative Director for Disease Control. And I think all of them are gonna take a couple of minutes and say something, and then we can take questions.
Thank you, Jane. So as she mentioned, I'm Jen Robalski, the Health Director for La Crosse County Health Department. And I think having a local health department perspective is really critical in situations like this. And I want you all to know that we work so closely with our state and federal health departments to make sure that we can do everything we can for the community, and we all play a part in that. So I want to back up just a moment and make sure everyone understands what it is that we're dealing with here. So COVID-19, or novel coronavirus as we've called it, belongs to a family of coronaviruses. And coronaviruses are a family that cause mild upper respiratory infections, typically in the nose, sinuses, and throat. These viruses are typically seasonal. However, this novel coronavirus is something different, as you all know. It is a new strain, and it was first detected in Wuhan, China. And this new strain, what we're finding, is causing more severe disease, and it's involving lower respiratory tract infections, including the lungs, and can lead to complications such as pneumonia, which is particularly concerning for our elderly population. So symptoms of novel coronavirus or COVID-19 include fever and respiratory illness, such as cough and difficulty breathing. In severe cases, as I mentioned, this can cause pneumonia, also bronchitis, severe acute respiratory syndrome, and even can result in death. So we take it very seriously. Symptoms can occur between 2 to 15 days after being exposed to this particular virus strain. And unfortunately, the symptoms are similar to flu, so it can be hard for us to know what symptoms we're actually looking at here. The spread does occur from person to person through respiratory droplets. So again, particularly as you cough or sneeze, this can be spread through those droplets that are expelled when we cough or sneeze. There is currently no vaccine to prevent COVID-19 infection, so the best way to prevent infection is to avoid exposure to the virus altogether. And that avoidance comes in a number of ways, one of which we've already talked about, the importance of washing our hands. The health department here in La Crosse County, as in other counties, are working with our local partners. So particularly, I've been meeting with administrators at private and public school districts. We've been speaking with our healthcare providers and connecting regularly with them. We've talked with municipalities and many more as we try to assure that we're preparing for the potential that we may need to utilize the tools that we have available to prevent the spread of disease. So this can include workplaces supporting their employees to stay home when they're ill. It can include school closures, and it can also include canceling public events. For coronavirus or any other public health emergency, it's always important to be ready and be prepared. So my message today would be, don't panic, let's be prepared, let's be ready together. And so make sure that you're thinking about the possibility that you may need to be quarantined for up to 14 days, and that you have enough food and water and medication on hand in order to be in your home for 14 days without needing to leave and go somewhere else. So one of the resources available to you is the website ready.gov, and you can reference that. And talk with your family and your employers about your plans. So I'll end with that, and I'll turn it over to Dr. Deo from UWL.
Thank you. Hi everybody, good morning. So I work at the Student Health Center at the University of Wisconsin at La Crosse. We also serve the students from Western Technical College. So I'm serving as a consultant for both those colleges right now. In some ways, institutions of higher learning are lucky because we have a fairly young and healthy student population. And one thing we know is that COVID-19 worldwide has been less symptomatic in that population. But we have some challenges as well because we have a fairly high density of students and staff in a concentrated area on our campuses and in the housing around our campuses. Luckily, we have a defined population, so we're able to send out a lot of directed messaging. We're able to do a lot of education on prevention, as these ladies have been pointing out, to help our students and staff stay safe. We're also doing a lot of work as far as cleaning procedures in our residence halls, and again, lucky for us, it is very similar to what we were already doing for influenza, but we're making sure that we're beefing up those efforts and being very careful that we're doing everything we can from a prevention standpoint. Another thing that has been kind of forefront for us is travel. We have a very healthy international study abroad program, which is being affected by this disease worldwide. So we have had to cancel our study abroad program in South Korea. Luckily, those students that were supposed to be there never made it to that country. We were able to keep them here in the US. We did have to recall students from Milan and other parts of Italy as that country went to the CDC level 3 warning. And there's a lot of other countries that we're watching because we have students placed throughout Europe and around the world. And we want to make sure we're protecting those students, but also we're protecting their education. The other thing is that we're going to have a lot of students traveling for spring break. Most of that is domestic, and there's currently no travel warnings that I'm aware of for domestic travel. But we know our students are kind of scattering all over the country, and so we're trying to provide them a lot of education, how not to get sick as they're traveling, as far as the hand washing, and going a step further for some of our patients or students is not sharing water bottles, not sharing drinks, not sharing vapes. Don't vape at all if we can get them to not vape at all, but if they're going to, please don't share from a disease spread standpoint. Is there, that's good, okay.
Good.
Pass it on to Dr. Jeff Jensen.
Hey, good morning, everybody. Appreciate the opportunity to be here. It's a good example of how everybody can work together when there's a community event that threatens all of us in some way. I think it's important to recognize that Mayo Clinic and my partners at Gunderson are committed to being prepared, and both our groups, we've been working on this for about 6 to 8 weeks prior to this meeting, on a regular basis. Our organizations individually have been communicating to our providers, our workers to make sure they're prepared to take care of any issues that come along if and when a patient enters our walls. I think it's important that we all recognize that prevention and disease control practices are a priority here. This is not a disease we can treat or cure, and I think it's important that we understand that we have been working hard to ensure those items are in place and the processes to take care of people, both our providers and our members of our healthcare teams are protected, as well as any patients that we come in contact with. There's a lot of information about the virus. A lot of people already shared it. Mr. Kine has done a nice job of that as well. But I encourage you to go to the CDC website. This disease process, what we learn about this disease is changing every single day. Things we thought about 2 weeks ago are new, or we're thinking differently today based on other people's experience. And the best place to go to that, I think, is the CDC website. Mayo, Gunderson also keeps their websites up to on the current recommendations, but I think it's important to recognize that we also are evolving as we learn things through this process. One of the questions that I anticipate will be asked about the surgical mask question. What we is recommended is don't just go out and buy surgical masks to wear them to prevent from getting disease. If you have symptoms, it may be advantageous. The risk is over purchasing of these masks may be sapping away resources that we may need at the healthcare sites to take care of patients when they're in our hospital walls. So I would encourage you to be cognizant of that, and if you feel you need to wear a face mask of some sort, be doing that when you have symptoms, not just trying to prevent it from happening, because it does not seem to prevent that. I'll stop there and hand it off to my colleague here.
All right, and thank you, Dr. Jensen, and Bridget Path from Gunderson. Infection control, definitely the COVID-19, all the things my colleagues have said here today, it's exactly what everyone is doing to prepare and think about what are we doing as a health system and what do we ask that you do to be our partner. It would be, if you think that you have signs and symptoms of this virus, to call ahead, whether that's to the telephone nurse advisor line or directly to your healthcare provider. That's the best way that the public can partner with us as a health system. If we put all the other patients in the hospital in jeopardy because we're screening patients, I think the key is we are prepared as a health system to be looking for and to be testing patients who might present with a travel history or other epidemiologic links at this point to tie them to a potential case. We focus on the things that are emphasized on the board over there, and wash your hands, wash your hands, wash your hands. Over 20 years in infection prevention, I think that's like my favorite sentence. And it's something that we're all paying attention to. Keep your hands away from your face, as we heard, but really the number one thing that we need as healthcare systems, we have plans, we have preparedness, whether that's supplies and the education for our healthcare workers, but we need to have partners that are making that phone call and not just presenting to the healthcare system, because there may be a time where we're directing you to a specific place in the health system. That constant evolution and updates are being posted, whether it's from the CDC, the state of Wisconsin, La Crosse County, or one of our health systems. We are all trying to keep the most accurate and up-to-date information available for the public, and I think all of those things are key to partnering with you as community members. With that, I think I'll turn it back over to you to lead the places, so thank you very much.
Are there any questions for the panel?
Since the most vulnerable part of the population, maybe the elderly, it was brought to my attention that we have senior citizen centers. Are there special precautions going on there, or are they following the general precautions that the rest of the population is?
I guess I'll defer to the
If you want to say.
Sure, I can start. So we actually, today at 3:15 are doing a webinar with nursing homes and assisted living facilities because, right, one of the things that we are learning through the evolution of this outbreak here in the United States is that seniors and those with underlying health conditions are more at risk for severe disease than other populations. And so we think it's really important to make sure that our partners who serve those particular populations have direct access to us on an immediate basis to start asking those kind of questions and start drilling down on the kinds of things that we need to be doing together. I think more broadly, the kinds of infection control that those facilities and congregate living settings are doing as it relates to the flu and other infectious diseases are exactly the kinds of things they should be doing in this scenario as well. I think they also can and should be thinking about their visitor policies and how they are encouraging visitors to interact with seniors who live there, who congregate there. Folks who are visiting should not come if they are sick. We should be really mindful and conscientious about the fact that this population is more susceptible than others. And I think you saw this weekend out of the CDC some additional guidance for seniors and for those with underlying health conditions as it relates to travel. And I would encourage folks to be mindful of those as well. But we are very conscious at the state level that this is a population that we need to make sure we are doing everything we can to put tools in the hands of folks who are in direct contact with this population. We later in the week will be doing a webinar more broadly. You mentioned congregate settings that are not living, so maybe an adult daycare or a congregate meal location where seniors gather. So we will roll out some more technical assistance and work with them later in the week, but we're starting with the nursing homes and assisted living facilities today.
And I'll just add, Brad, that I think it's important for these types of sites to be thinking about their cleaning practices. You know, all of those light switches, doorknobs, anything that individuals are touching. This is a balance for this population with the importance of social connectedness, and if we're talking about congregate meal sites, the ability to get a healthy meal. But if they are not feeling well, they really shouldn't be there. And I also think that, you know, individuals who may have underlying health conditions should be considering that balance between not attending if they can, in order to assure that they don't develop symptoms. Now, right now, we don't have community spread, but I think that that's coming, and we should be preparing for that. So I think, you know, those are some of the aspects for these individuals to be thinking about, and those sites can all work together to assure that we keep those individuals healthy.
So I think you kind of mentioned it, like community spread could be possible. So have you guys spoken with people down in Dane County? I know they had the one case and it hasn't spread anywhere. So do you guys kind of use that and how they handled their case down there as a model for how we could handle it here in La Crosse?
So you're right, we did have one confirmed case in Dane County. The patient self-isolated and has came back negative on 2 sequential additional tests, so has been cleared from isolation and has now gone back about their daily life. And so we do think that it was an important testing opportunity for us. Not that this poor individual wanted to help us with that testing, but it was an important reminder about the muscle that we all have as a public health system about how you do infectious disease monitoring, surveillance, contact tracing, etc. And so I do think that as a public health system, in our communications with each other, we are learning from each other about that particular case. But also, local public health does this stuff on a regular basis, whether it's COVID-19 or TB or measles or the flu. It is what they do, boots on the ground every day. And so they are practiced, they have muscle around it. This is different because there is not a vaccine or treatment, and so that is why we are all worried about, for example, people with underlying health conditions, about seniors, and about the impacts it could have on our daily lives and our economy. So we want to make sure we mitigate and stop the spread if it returns to Wisconsin, when it returns to Wisconsin, as soon as possible. But that is the nuts and bolts of public health in the state of Wisconsin, and so you have soldiers on the ground, boots on the ground all over the state who are doing it on a daily basis and are good at it.
So I'll just add that, what we have learned, we have a number of what we call persons under investigation in the state of Wisconsin, and a couple in La Crosse as well. And so far I've been very encouraged that those individuals are staying home, and they have not been potentially spreading to others. So that is a really important aspect of this situation. But Andrea's right, we do this type of investigation process all of the time. So we're used to interviewing potential clients that may develop COVID-19 even before they get the positive test result, asking them about who their contacts may have been, if that contact needs to be within 6 feet, for example. So helping them understand who to think about in terms of who may have been exposed. We're contacting those individuals when needed and educating them about how this virus spreads, what we know so far, and we're working that way to try to limit the spread. So the better we know about individuals who may have been exposed, for example, travel histories, if anyone has returned from these 5 countries in particular, China, South Korea, Italy, Iran, and Japan, which is a level 2, we would love to hear from you, because that gives us the chance to connect with you and talk to you about what the symptoms you should be watching for. If you develop them, call the healthcare provider or the healthcare institution first before going in, all of that sort of thing, to prevent the fact that they end up having symptoms and spread it to others before they realize they're doing so.
Jim, you said there are a couple of people in the La Crosse area or the general area who are under investigation. Could you clarify more what that means?
Yep, so what that means is that a person under investigation means that an individual either has a history of travel to one of the countries that we're concerned about, and or they have been exposed to someone with confirmed case of COVID-19. So please remember, we're on a border county, and so our healthcare systems treat individuals that live in La Crosse County, around La Crosse County, in Minnesota, and so we have a really good working relationship. We just learned about that over the weekend, how good that relationship is in terms of, if this is an individual who's a resident of Minnesota, for example, but they're being treated at a Wisconsin healthcare setting, we can send that sample to the state level of hygiene if needed and if it's warranted. Vice versa with if an individual from Wisconsin is being treated in Minnesota, those testing results can be sent to Minnesota. So I think that relationship is so critical. But that person under investigation just means we're watching them more closely because they may develop symptoms or they may already have symptoms, and then we want to just make sure that we're decreasing the spread by asking them to quarantine if they don't have symptoms yet, isolate if they have symptoms, and making sure that they're not spreading while we're figuring out the confirmation of the test.
Question. As a RN that works in long-term care, both nursing home and assisted living, these facilities typically will carry surgical masks, but not N95 respirators. So this might be a question more for the state. They have, most of them, under my understanding, do not carry or have N95 respirators, which they would need if they have a positive case in their facilities. Is there any recommendations? I know that at this point, they're having a hard time getting those respirators. Do you have any comment regarding that?
We are actually, about to hit the field with a survey about, access to appropriate PPE, N95s and, gowns, et cetera. And so we will have a better sense here very shortly of, what the landscape in Wisconsin looks like, from a statewide perspective, about access to, needed, protective equipment. I think we are hearing anecdotally, from some, about the need to secure, additional, surgical masks. But I think we will know a lot more about the state of play for long-term care and assisted living after this 3 o'clock call today, and we'll understand whether or not we do have a need to deploy additional masks. I think what you're seeing at the federal level, you will see here at the state and local level as well, which is people are having trouble, healthcare providers are having trouble getting their orders fulfilled. The global market is trying to stand up capacity in manufacturing in anticipation of increased demand. And I know that the Vice President has highlighted that as something that he has been talking with manufacturers about. But this is something that we are closely watching and that we know we need to make sure we understand what it looks like here in the state of Wisconsin. CDC does also have guidance about how you about the utilization of PPE and about how you triage that. And so there is some guidance out there already. If you are in a facility that does not have what you need, there is guidance about how to use what you have to continue to protect your workers and the people that you're serving. But others may want to say.
Add, I think, as we look at the data that's come out of China and the information, the state of Wisconsin is adhering and recommending that airborne precautions and that hands-on and N95 mask, as you say, and well, guess what, we don't have any of those. We, at the hospitals, are prepared with, we've got the PAPR or special purifying masks and N95 masks, but you wanna put a mask on your patient and get them to contain their droplets, keep it to themselves if possible, if they can tolerate that. That's the same thing as what we're saying when they come to us, is call ahead so we can have that mask ready for you and be prepared. I think it'll be interesting as we see this unfold, and will it remain airborne precautions or switch over to a droplet precaution type of virus? All of that is the pace of change with this particular virus is so very fast, and we need to be paying attention to your needs in the assisted. The hospitals would be overwhelmed if all of a sudden we just tried to empty some of the long-term care facilities and send all of those patients because you didn't have capacity. So we want to help, we want to be your partner as well.
And similarly, I'll just add that I think to the general population, there is this tendency to want to purchase masks, but please understand that surgical masks are not helpful when it comes to droplet precautions and the spread of droplets with this virus. And the N95 respirator mask really requires fit testing so that it can be effective. So these are not the best things for you to prevent the spread or prevent getting it yourself. The best way really is hand washing. So by you not going out there and trying to purchase these masks, which are not going to be effective for you, you allow that supply chain to be available for the healthcare providers and the long-term care facilities who will be preventing the spread of disease and death in our communities. So please remember that.
Are there any other questions?
How many people in La Crosse, if any, have been tested for the virus?
Well, I think What I can say is we have no confirmed cases of the disease right now, and that we will continue to be prepared to test patients and screen them for the symptoms of the COVID disease. But at this point in time, really the emphasis would be that we have no confirmed cases.
Any other questions? Okay, then with that, I'm assuming some of you may be available if any of the media outlets want to talk to you individually. Otherwise, I think you're free. Well, thank you all for your help in getting